Dr. Jeffrey Gerdes. I wanted to get you a little bit of information about our non-surgical laser disc decompression. It's a treatment we're doing here in our office to treat disc herniations, disc bulges, degenerative disc disease, degenerated discs, sciatica, or radiating pain, numbness in the arms or legs. So we're combining spinal decompression to treat the discs with class 4 medical laser. Let me explain a little bit first about how the spinal decompression works. So this is a model of our spine. I'll hold it up. And if you look here, we have the disc, then we have the nerves, okay, vertebrae, and spinal cord. So these nerves run out of our spine, and when they're being compressed or pushed on, this is a better view, by a herniated bulging disc, then we get radiating pain down our leg, sciatica, shooting pain into our upper back, shoulder, and we can have numbness in our arms and legs, or lose strength and get weakness in our arms and legs over time if it lasts for too long. The spinal decompression, okay, when we have a disc that's working properly, there's a pumping mechanism. And sorry, this video isn't really the best, but let me see if I can get this up. There's a pumping mechanism. When we walk, when we bend, when we pick something up, this disc, which is 86% fluid in the middle, it has a normal pumping mechanism. It goes in and out, it moves. When that pumping mechanism fails, we get a bulge, herniation, a disc that ruptures, or disc degeneration.
A herniated disc occurs when some of the soft jelly-like material in the center of the disc slips out past the tough exterior. It can be very painful and may cause back pain, neck pain, shooting arm pain, tingling, numbness or weakness in the leg, foot, or arm.
The spinal decompression, we have you on our spinal decompression machines, and it brings your back in and out over a series of treatments, and often around 25 to 30 minutes, it reestablishes the pumping mechanism. Another reason people get pain or have ongoing pain in their spine is these discs, okay, they're avascular. They don't get a good blood supply. So this is why we know somebody and they've had back pain for 20 or 30 years, or they have neck pain and they're always complaining about their back or neck. Oftentimes there's an underlying injury, and these discs aren't getting enough blood to properly heal. The spinal decompression, it drives circulation and blood flow into the area so oxygen and nutrients can be delivered while reestablishing the pumping mechanism.
Spinal decompression therapy is an effective treatment for disc degeneration, bulging discs, and herniated discs. It works by reducing the loading on lumbar degenerated discs, restoring normal height, and relieving pressure on the spinal nerve, while allowing vital nutrients and fluids to flow back into the disc.
It does something else as well. When you're with the decompression, think of this like an accordion. It's bringing your back in and out, in and out. This creates what's called the vacuum phenomenon. That pressure, when your spine is brought out, held, it creates almost like a suction cup effect in the disc. And if that disc is pushing out on the nerve, it can bring that disc in over time through the vacuum phenomenon, and that can help heal the disc and get the pressure off the nerves. Now we're also combining this with our class 4 regenerative medical laser. It's a federally trademarked treatment, the non-surgical laser disc decompression. We do class 4 laser in conjunction with the spinal decompression. This does several things in our body. It treats the cells on a cellular level, those cells that are injured and making you feel pain and not healing the area where there's some type of dysfunction or chronic pain. Those cells get injured and worn down. Think of like a battery that's lost their charge. or a cell phone battery, your iPhone that's run out of battery life, or your car battery that's died maybe in the past. You stick your key in, turn it to turn it on, and it won't turn on. Where our cells, they lose energy and charge as well. The laser goes into the cells on a cellular level. Those cells take the energy from the laser, it's transferred to them. It creates a chemical reaction and produces ATP, or adenosine triphosphate. That's our body's energy molecule. So those cells that are worn down, they get charged up with the energy in the mitochondria, the engine of the cell, and they start functioning like normal cells again.
Laser therapy delivers photons of light that penetrate deeply into tissue and accelerate cellular reproduction and growth. As a result of exposure to laser light, the cells of tendons, ligaments, nerves, and muscles are repaired faster.
The laser also brings down the chemicals in our tissues that make us feel and experience pain. So there's prostaglandins, other chemicals called COX and LOX, interleukin. It inhibits the production of those chemicals, and it makes us not feel the pain that we are experiencing because it brings down those chemicals from being released in our tissues that are emitting those chemicals and making us feel and experience pain. It's being used by all the pro sports teams. It's being used locally here, Duke Hospital, on back for back pain, joint pain. It's being used in orthopedics as an alternative to steroid injections. It's even being used in veterinary medicine. They're using it at Harvard's hospital over the brain, at the Wellman Institute of Photomedicine, for patients that have had Alzheimer's, dementia, and they're getting their memory back. It's a really interesting field called photobiomodulation. We're seeing great things here in my office. I'm going to put a couple of videos in here to explain the whole process, and I look forward to answering more questions with you here soon on our consultation.